Hello, everyone. My name is Joel Munson. I'm the research coordinator for the Realm of Caring Foundation. Today, I'll be presenting on a cross-sectional and prospective comparison of medicinal cannabis users and controls on self-reported health. The authors of this were Schleins et al., and I'm Joel Munson. Really quickly about the Realm of Caring Foundation, we're a 501c3 nonprofit founded in 2013. We're located in Colorado Springs, Colorado, right up the road from Pueblo, where this conference is happening. Our mission is to do research into the potential benefits and harms of therapeutic cannabis and to disseminate that information to healthcare providers, parents, teachers, anybody that could benefit others or themselves from this knowledge. And we offer support in the form of a call center here, and we have resources on our website, all complimentary. Currently, we support over 65,000 people worldwide. This topic that I'm presenting on is actually the first paper that we have gotten published from this research project called the Observational Research Registry. This study came about because the Realm of Caring was consulting many different individuals on how to use cannabis therapeutically. And people were reporting all kinds of benefits to us. And to the medical community, at that point, it was only anecdotal. There wasn't enough evidence for them to believe what we were hearing. So we found it to be important to start to collect data in a very scientific way. And so fortunately, Hopkins was interested in partnering with us on this study. So we launched the ORR back in 2016. This is an online survey-based, self-reported study. It's open to anyone in the world as long as you're English literate. You don't have to have a diagnosis. You don't have to be using cannabis to be in the study. And we want those individuals in the study because they serve as the control group. So the Realm of Caring recruits, retains, and funds the study. Hopkins does everything else. And like I said, this is the first published paper. It was just released in Cannabis and Cannabinoid Research a couple months ago. We will have more condition-specific papers coming out, a couple this year, hopefully, but definitely more in the near future. It's going to be an ongoing project with tons of data and a lot to publish on, hopefully. So the intro goes as this. The cannabis became a medicine in this country in a very unorthodox way. Most medicines are only approved after they go through clinical trials to prove their safety and efficacy. Well, cannabis was approved through the legislative process, so we never had a chance to collect any of that data. There are over 2 million cannabis users, medical cannabis users in the United States, and that's only those who are registered with their state programs. There are likely a lot more people using it to try to get benefits, and they're working with their doctors. And so it's really important that we collect this data to help inform all of these users. So our goal was to characterize the demographics, the health characteristics, quality of life, and healthcare utilization of cannabis users. And we looked at a convenience sample versus well-matched controls. And our goal was to look for signals and to help us identify specific health conditions and cannabis formulations that could further be explored through traditional approaches like randomized controlled trials. We looked at the impact of the initiation of cannabis use by controls, the cessation of use by users, and then the impact of the maintenance of use. For our methods, we had 1,276 users all registered with the Realm of Caring. They were invited to do follow-up assessments every 3 months, and we used Qualtrics. They told us self-reported demographics, healthcare utilization, medication use, cannabinoid use, pain, anxiety, depression, sleep, and quality of life. So we looked at the users versus the controls, and they used negative binomial regression and linear mixed models to do their statistical analyses. The results of the study so far, at least in this snapshot, are that cannabis users are self-reporting across the board better quality of life, greater health satisfaction, improved sleep, lower pain, anxiety, depression, less prescriptions, and less hospital visits. And that's all against well-matched control group. And then the controls who initiated showed improvements that were just as wide of a gap as the difference in the groups at baseline. And so we found this to be very promising initial data. Cannabis use was really associated with improved health and quality of life. It's presumed that the group differences are likely due to the therapeutic use of cannabis. Of course, there's potential for a lot of bias in this study. Those who are involved in the study are likely have a strong opinion of cannabis to begin with. They might have some placebo effect. And another factor is that they're likely getting coaching from the realm of caring, and it's possible that they were able to better utilize cannabis under better coaching and get better results. And so we think that clinical trials using defined products for specific conditions are warranted based on the data that we've seen so far. If you're interested in joining the study or helping to promote it, you can go to realmofcaring.org/ORR. And if you'd like to read the full text of this paper and look at all the charts and graphs, you can go to realmofcaring.org/ORR paper 1. And there's our phone and email in case you want to reach out. Thank you for your time. I look forward to your questions. Thank you.